Doctor, how important are the women wellness checkups?
The well women checkups are something that we do during the normal health of a woman. So it is when they are neither diseased nor injured. So when you just, do these tests just to see whether the woman is in her prime of her health or not. So these are part of preventive health checkups that are coming up now. So even before there is any kind of disease, we try to detect if the woman is suffering from any kind of abnormality. So these are done on an annual basis, on a yearly basis. And not all women like to undergo these tests, but they definitely are of good value for them. So here what we do is we do a couple of blood tests on them. So we check, like their blood levels, their hemoglobin levels, and we check their blood counts. Apart from that, we do tests which determine if their liver is functioning properly, so called as liver function test, the kidney function test, that is to see if the kidneys are functioning properly. Then we do a couple of hormone tests, like we test for the thyroid hormone. We also do a blood sugar to check if there are any signs and symptoms that she might be becoming a diabetic, which is quite common now. So all these things are done through these blood tests. Apart from that, we also examine the woman. We do a pelvic examination to see if there are any abnormalities in the gynec tract, if there is any infection that the woman has missed, especially sexually transmitted diseases. So these can be treated at the opportune time if we can detect it early before they even cause any other complications. And apart from that, we also do what is known as a pap smear. So in a woman in whom the pap smear turns out to be normal, it is done once in 3 years. So this is a test where we take a smear from the cervix. So this helps us to detect if there is any cervical cancer. So it also acts as a screening method for cervical cancer. And India is one of the countries with the highest number of cervical cancer cases. So by doing this simple test, it's a very simple painless test, and we can detect a lot of women who might be in the early stages of cancer, and thereby either take the appropriate treatment at the right time, or if not, if it is in a pre-invasive stage, even give some preventive measures to prevent this. So we also do testing for human papilloma virus, HIV, HBsAg. All these are sexually transmitted diseases, VDRL. So all these are diseases which are transmitted sexually and which can be treated. So all these are done as a part of the Well Women package. So another thing that might help when the woman comes for these, tests, we can also counsel the women regarding a lot of other lifestyle changes that can help her with her day-to-day life. And we may also take it as an opportunity to give certain vaccines for a woman, which may help in the long run. Like there are some which are very exclusive to women. So now we have the cervical cancer vaccine. So by taking this vaccine, it prevents cervical cancer. Then apart from that, we also have the MMR or the rubella vaccine, which is very important, because rubella is something that can affect women and their offspring when they get pregnant. So a simple vaccination can prevent these diseases in women. So that is why a Well Women checkup, though very uncomfortable and not many women like going through this, but it may add a lot of benefit for them.